Hi, my name is Ruhani Dillon, and I am an occupational health specialist for Inscudo Memorial Hospital. I will be talking to you, recently hired radiation technicians, about ionizing radiation safety. You will all be in contact with our x-ray machines, so it's important that we cover a few discussion points to get you guys familiarized with proper protocol and ensure that you have a safe and enjoyable work environment here at Inscudo Memorial. As a disclaimer, I want to emphasize that this is for a final presentation for the Environmental Health Sciences class in the College of Public Health at the University of Arkansas for Medical Sciences. This is a student presentation using a hypothetical scenario for educational purposes. The presenter is a student at UAMS, not a representative of the agency named in the following slides. The information contained herein does not necessarily reflect the views of said agency. As mentioned previously, I will be talking about a few points with you guys to get you prepared for this job. To understand ionizing radiation safety, you have to first understand what ionizing radiation is and the effects of ionizing radiation exposure. We will be talking about acute exposure, chronic exposure, the symptoms, and the effects of the exposure on your body. We will also be talking about protection and prevention strategies to minimize ionizing radiation exposure. This will be done through safe workplace practices that you will all be familiarized with. Lastly, we will talk about employee actions in the unlikely event of a high-dose acute exposure. This will be our emergency preparedness plan that you should all know. So what exactly is ionizing radiation? It is a form of radiation or emitted energy that can cause subatomic changes to create charged particles. It's the transferring of electrons in atoms to make an unbalanced and highly reactive particle. This is found every day from the sun, X-rays, which is what you guys will be dealing with, and nuclear power plants. Again, we're exposed to ionizing radiation every day. However, there are levels of ionizing radiation that can be very harmful, which is what we will be discussing today in order to minimize the level of exposure and keep you guys safe. When we talk about the effects of ionizing radiation, we're usually talking about chronic exposure, meaning low doses over long periods of time, which is what this job entails. This can cause damage to tissues from double-stranded breaks in your DNA, leading to the most likely effect of cancer. This cancer develops from mistakes in DNA repair mechanisms, and the more exposure to the radiation that you have, the more likely that cancer will develop from different instances. The presence of double-stranded DNA breaks are important as this distinguishes ionizing from non-ionizing radiation, which cannot damage your DNA. Ionizing radiation can also cause potential damage to organ function. If high doses are received, this could lead to heart or liver disease. As radiation technicians, you will be in contact with machines that emit ionizing radiations, like the X-rays. Your role will be to operate this machinery and administer the radiation to different patients. You'll have to ensure that you are following proper safety protocol and monitoring the machinery closely. I'll outline how you'll do that in the following slides. It's also important that you report any concerns to your supervisor immediately in regards to your safety, the patient safety, or the integrity of the machinery. Since we already discussed the roles and responsibilities of your job, now we're going to discuss the various machines that you'll be using here at the hospital. there's a variety of machines that you will be operating as a radiation technician. They're arranged on this slide from the lowest to the highest amounts of ionizing radiation exposure. The first one, and the one that I mentioned previously, are X-rays. They direct a controlled beam of radiation through the body, and they are by far the most common scan that we undergo here. The next one is a CT scan, which uses rotating X-ray beams and advanced computers to create a detailed picture of the body. So this is a step above X-rays, as they use multiple X-rays to scan the body. The third machine that you guys will be operating as radiation technicians is something that we call a linear accelerator, or LINAC for short. This by far has the highest amount of ionizing radiation within them, and are usually used in our oncology unit. The LINAC uses high-energy X-rays or electrons to destroy cancer cells as a form of chemotherapy. So you guys will be familiarized with all these machines as you continue to work with us. It is imperative that you adhere to the protective guidelines outlined by the hospital. For instance, you must wear proper personal protective equipment, or PPE, to minimize skin exposure to ionizing radiation. Ionizing radiation cannot be seen, so it is important that your skin is covered at all times when in the room. PPE includes gloves, lead aprons, long-sleeve clothes, and closed-toed shoes. I want to emphasize that this will be part of your required uniform upon starting this job. Additionally, we have the ALORA principle in occupational health that stands for as low as reasonably achievable. You want to minimize your exposure to ionizing radiation as much as possible while also doing your job. This will keep you safe, as you all will be in numerous situations where you will be exposed to the X-ray. There is a danger to exposure. However, following all these guidelines will ensure that you stay safe. There are also prevention strategies for minimizing ionizing radiation exposure, most of which are administrative and policy-driven. For instance, within this hospital, we have our radiation safety officer, who is the expert on all of the machines. So if you have any questions about properly handling any of the machines, please go to them for guidance. You should all know who your radiation safety officer is and have their number. They are certified to monitor all of the safety compliances conducted for our X-ray machines. You all should also have a dosimeter to monitor the level of radiation. Anything above 50 millirem is considered concerning. Please report this to your safety officer immediately. This facility also follows the OSHA regulatory compliance. So, as staff, you radiation technicians, will check the machine before every use, including checking the cables and safety features. In addition, every X-ray is professionally calibrated every year, and the state government also undergoes compliance inspections every year for each of the X-rays. As I mentioned, when we discuss ionizing radiation exposure, we are usually talking about chronic exposure. This is because acute exposure is high doses of radiation from mishandling of equipment, which should not be done if you are following the proper protocol, protection, and prevention strategies I've outlined in the previous slides. In the case of acute exposure, we have an emergency plan in place, which I will outline in the next slide. It's important that you all know the signs and symptoms of acute exposure. For skin exposure, you may notice what looks like burns. Your skin may be red and irritated, or even necrotic at places. You may experience nausea, vomiting, or other GI issues. You may also experience sudden hair loss or itchy and tingling skin. It is important to recognize each of these symptoms, as medical attention is needed immediately. In the event of an acute exposure, the first step would be to remove yourself immediately from the area with the X-ray while trying to contain the radiation as best as you can. If someone is there, alert them of the situation immediately. There will be an emergency kit in every room, which you will find a provided bag. Place any contaminated items within this bag. If applicable, wash any area of your body that was exposed to the radiation. For instance, if you notice that any part of your skin feels itchy, tingly, or looks red, wash that portion with soap and water. Next, you should seek hospital care. As mentioned, ionizing radiation can have damaging health effects. Speak with a healthcare provider about the incident and they will be able to properly assess you. We have an emergency department in our own hospital that will be able to assist you. Finally, if not done already, report the incidents to the radiation safety officer or your supervisor. This is important to make sure that the area of exposure is safe and that no one else is exposed. I also wanted to take a moment to emphasize your rights as a worker and an employee according to the OSHA guidelines that we follow here at Inscudo Memorial Hospital. You have the right to receive workplace safety training in a language that you understand. This entire presentation has been in English, but please reach out to me if you would prefer to have a presentation in your own language. It's imperative that you fully understand all this safety training and to ensure that you and others around you are in a safe environment. You also have the right to receive required safety equipment. I had mentioned that all the safety equipment that you need, we will provide for you. You have the right to request an OSHA inspection if you feel unsafe or that the equipment is hazardous. You can do that yourself or through me or your radiation safety officer. You have the right to report an injury, and you should report an injury. We highly encourage you to. You have the right to review records of work-related injuries. You also have the right to see results of those annual maintenance tests that I had mentioned previously. A large part in ensuring proper employee safety is making sure that you are all safe outside of the obligations of your job. I know that we have been talking a lot about ionizing radiation, but safety on the job is all-encompassing. While you are employed, there will be routine physicals, wellness screenings, and drug tests. I want to mention that your employee benefits include medical insurance, in which your physicals can be done here in the hospital. If you fail one of these examinations, you would no longer be able to be employed as a radiation technician here at Inscudo Memorial. Furthermore, you must become recertified every year and complete the annual renewals from the American Registry of Radiation Technologists. Failure to comply with a licensure will also account for termination of this job. This is in order to make sure that you are all properly trained and are keeping up with the newest safety regulations. So in summary, ionizing radiation has the ability to alter atoms within your body, and it's found in everyday life. Chronic exposure to ionizing radiation is normal, and the protection and prevention strategies within this hospital work to minimize the level of chronic exposure that you will face during this job. However, there are still health risks to being a radiation technician, and the safety protocols should be taken seriously. It is important that you all follow the protection and prevention plans outlined by this facility, the Inscudo Memorial Hospital, that you all have safe workplace practices, and that you review emergency protocols in the event of an acute exposure. Doing all these things will ensure that this remains a safe and productive environment for staff and patients. Thank you all for listening to my presentation. I hope you enjoy working with us in Inscudo Memorial. Please feel free to reach out to me with any questions or comments you may have, and congratulations on this new job.